the ideal, but the people need somewhere where they can live. They need a roof over their heads. And so I ask donors to come on board. The government not doing enough. And they seem like they don't business about Hanover. They have a responsibility to the people of Western Hanover. And I'm asking the government to step up and do what they're
Government
supposed
a
to
dirty
do,
nigger,
while
man.
I implore and ask donors to come on board and help the people of Western Hanover to fix their roof. This is not politics. This is humanitarian. People are hurting, their lives and livelihoods have been damaged and lost. I thank you.
You tell you, man, all nigger them.
Thank you, MP Miller Bennett. We're going to hear from the other Member of Parliament in Hanover. She has been advocating relentlessly for her people. I welcome Member of Parliament Andrea Perkins.
It's a grieve, Mason, man. I'm so grieved.
Good morning, everyone. Party President Mark Golding, my colleagues, to the viewers. For the people of Eastern Hanover, the date October 28th marked the beginning of a crisis that continues weeks later. Let me be clear about what Hurricane Melissa did to Eastern Hanoverians, because the scale of devastation has been systematically underreported and in many cases completely ignored by the media coverage.
Yes.
Every single board house in Eastern Hanover has been affected, damaged, destroyed. Approximately 5,000 houses are without roofs. Every farm in the constituency suffered severe damage. Half of our health centers sustained significant structural damage. Our schools are so badly affected. This morning, I got a call from the principal of Brownsville Primary, and she asked me who is responsible for the persons in the shelters. Her name is Miss Bucknell. She has started school last week because parents are not able to help the children at home and prepare them for exams that are coming in a few months. And so she rushed to open Brownsville Primary, and I understand. But she's crying out for help because she cannot be the person that is responsible for the persons that are now staying in the shelter. So I'm asking government to pay attention to the schools. All of our schools have been affected. Most of the schools in Eastern Hanover, they have no roof. Residents in Chigwell, Forest, Woodsville, and other areas were trapped for weeks. There is a man-made bridge in Woodsville from 2022. That bridge was partially collapsed. In 2023, it went down for good. The residents are in dire need of attention from government. That man-made bridge was destroyed again.
Whoa.
And so the residents of the Woodsville area, they're asking for urgent attention. Water supplies were contaminated. I myself was marooned in Cascade. Residents, though, came out and assisted us. And that is a pattern that I've noticed since Hurricane Melissa, that residents have taken it upon themselves to do the work of government because the parish of Hanover has not been included in many things, especially where relief is concerned. The morning after the hurricane, residents assisted me in cleaning 18 miles of roadways so I could get to the main road to coordinate relief efforts. I want to address the government's response or lack thereof. It is true that affected constituency received $10 million. Many of my colleagues have done the math. For housing, it is not adequate. We have a number of houses in Hanover. From my balcony, I am looking at 3 houses that are flat and 5 without roof. The people of Eastern Hanover, they've had to seek comfort living under tarps. That's not good enough. We need help from government. We need
One more,
ministers
no, and tell me
to
say the
come in
government can move better
and
than
be
this.
on the ground as they were before the election.
It's a big old dirty disgrace in our
The
country,
people of
man.
Eastern Hanover, they're demanding your presence. The question I must ask, and the question every Jamaican should be asking, if the allocation on paper is equal, why is help actually reaching our residents so dramatically unequal? Where is the relief going? Why are communities still waiting? Government response has been extremely slow in Eastern Hanover. Corporate Jamaica, though, has stepped up. Companies like Flow, Red Stripe, CM Recycling Company Limited, Trial Hotel, and Billboard King Foundation have provided more immediate, tangible relief than government agencies. Our diaspora family responded with urgency and generosity. And I must thank PNP leadership, former Prime Minister P.J. Patterson, a proud Hanoverian, along with President Mark Boulding and MPs Anthony Hilton and Julian Robinson, who have been mobilizing assistance, and some of them have been on the ground providing moral support to our traumatized communities. Eastern Hanover is facing a public health crisis that needs immediate intervention. Western Jamaica has already confirmed 11 cases of leptospirosis since Hurricane Melissa. And that's a deadly waterborne disease. I spoke of waterborne diseases 2 weeks ago in Parliament, still no attention. And on behalf of the citizens of Eastern Hanover, I want to ask the question, what is the purpose of elected representatives going to Parliament and voicing the concerns of the citizens without any notes being taken or any attention being paid to these citizens? There is literally now a mountain of garbage at my personal gate. I live in my constituency. The National Solid Waste Management Authority has failed to maintain consistent collection, and our residents are suffering the consequences. We're deeply concerned about leptospirosis, dengue fever, and other waterborne diseases threatening our people in areas still cut off from proper medical attention. Whether the design is by oversight or the Ministry of Health has omitted the parish of Hanover from its island-wide plug-in schedule, I don't know. But believe it or not, Hanover as a parish We have areas where the water continues to rise. The water has a stench. And up to date, I have not been contacted by anyone from the Ministry of Health to say we are going into these areas to check, to run some tests, to check on the citizens. We have a number of senior citizens in Chigwell, in Forest. These senior citizens have had to travel by means of foot track to get to hospitals, to the 3 out of 10 clinics that we have operating now. Some communities remain isolated. Residents still lack access to potable water. Families are living under tarpaulins or in homes with no roofs. Children are trying to attend schools. I am here today to make our needs absolutely clear. For the most part, Hanover is still technologically marooned. A lot of persons are still not able to get connection. Those Starlinks and generators were given to the government. We did not even receive a single generator to power our constituency office to serve the people that elected us and the entire constituency. We need the Ministry of Health and the local health department to deploy mobile medical units to isolated communities. We also need aggressive vector control measures. We need consistent garbage collection immediately before we face, as I spoke about before, a full-scale disease outbreak. 7 of 10 of the health centers need to be repaired with immediate effect. Our roads need more clearing. Our water systems need restoration. Our schools need immediate structural assessment and repairs so they can serve the essential functions. Our farmers need seeds, and I know there has been an allocation through RADA, but we're asking for more. To the people of Eastern Hanover, I see you. I have walked through your communities. I have witnessed your suffering and your remarkable resilience. You elected me to fight for you, and I will not stop fighting until you receive the help you deserve and the dignity you are owed as a citizen of Jamaica. I want to share stories, and these are not just stories, but things that I've seen with my own eyes. I witnessed the previous Member of Parliament, Dave Brown, driving through my community with the same care packages that the government gave me. Only 250 care packages, 5 tarps, and 50 cases of water. To date, that is all that I have received. Now, when a previous Member of Parliament drives through communities like Paddington, Cocoon, Claremont, Retrieve, Cascade, Hunside, it cannot be 250 care packages that he received. I am asking the government had an opportunity to be great, to look good. After the hurricane, I reached out to JLP caretakers. I left messages for them, and I assured them that whatever relief I receive as Member of Parliament will be shared with them. I did not receive much, unfortunately. Where the assessment is concerned, I sent out a schedule 2 days ago on a community group. It is a very touchy topic, but the government is playing politics. When the Ministry of Labor and Social Security goes to Axandas 2 days, Axandas is a tiny community in Chester Castle Division, and areas like Horton Grove that are 5 times the size of Axandas, still no visits. Tell me there is no politics involved. I want to thank the public sector, the private sector. I want to thank the families from Hanover that are living overseas, the diaspora, for stepping up and helping us. Red Stripe, you came in and you were so amazing. Over 500 care packages. Flo, you came in twice, not once, but 2 times into Chester Castle. Chester Castle is my ground zero in Eastern Hanover. I want to make an appeal to government that the people
They not listen me
of
there.
Eastern
Them not
Hanover,
go listen.
they're watching.
Them are all
The
nigga.
people of Jamaica, they're watching you.
And the world I
The
watch.
people internationally, people are looking at what you're doing. I am yet to go into some of my strong areas, but I've gone into Pumpkin Bottom, where 80% of the residents voted against me. My mission is one of humanitarian. I cannot be doing politics in such a catastrophic time. And I am asking the government to cut out the PR and get to the people. I have nothing against the Jamaica Defense Force, but I can tell you that I am against the government giving them the care packages to get to our people. I've witnessed myself in Sandy Bay and Hopewell on the main road, 2 trucks dropping off care packages. Our seniors in the lanes are not benefiting. The residents up in Mount Pelion are not benefiting. The residents inland are not benefiting. The people of Eastern Hanover deserve better.
Agreed.
Finally, to the people of Eastern Hanover, we're strong. We are resilient. We will get our constituency back together. Thank you.
Thank you, MP Perkis. We are joined by Member of Parliament for Northeast St. Elizabeth, Zalika Jess, and we'll hear from her now.
I don't need to do this almost
Good
every
morning.
day.
Today I come before you with a very heavy heart.
Jesse look prettier, man.
Today I wish I didn't have to speak because I understand that by speaking, I run the risk of being accused of complaining. But I speak because I have a duty to the people of Northeastern St. Elizabeth who elected me to be their voice and to be their compass. My issues today are multiple, but I will give you the abridged version. And I'll start with the long-standing practice which has really merged into a convention whereby ministers or officials of the government ought properly to notify a sitting member of parliament before entering
Disrespect
that
them, disrespect
MP's
her now.
constituency
Disrespect.
to do any government-related issue.
Disrespect.
Now, that is not just a matter of parliamentary etiquette or constituency etiquette. It has its rationale in ensuring that as the duly elected representative of the people, you can be informed as to what is taking place in your constituency, so that by extension you can inform the people, so that you can make yourself available when the government officials are present to continue to represent and advocate on behalf of your residents and your constituents on issues that concern them most, issues that you might not have an opportunity in the parliament to raise because of the rules of the parliament. In a time like this, a very sensitive time when the most vulnerable are most at risk, we expect that practice would ensure that there is collaboration between the government officials and the elected representatives to ensure that persons can benefit. In my constituency, I have had to sit and watch as persons approach me the day before a visit to ask me if I heard that the Minister of Local Government is coming into the constituency. What is it that they're coming to do? Where can they meet them? And I have no answer to the questions because I was not notified in advance. In my constituency, first, the Speaker of the House came, and perhaps she came in her capacity as an individual outside of the politics, but by her utterances, she made statements to suggest that she had visited communities, and every community that she visited, residents were not hopeful that they would get any assistance from me as the Member of Parliament. And I thought it was very unfortunate that in a time like this, we would seek to sow seeds of division and discord, because the Speaker of the House visited 3 communities, all strongholds of the Jamaica Labour Party. Not one PNP community was visited. Not one PNP community was given any of the care packages. In fact, the areas visited are well
And that
known.
today I run the country, a criminal them, you know, man.
Which is regarded
But you never know
by
it hurt
Edward
me, man.
Seaga's Little Tivoli. No reference was made to any other communities, but the Speaker formed the conclusion that every community she visited were not hopeful that they would get help to build back houses or do repairs. And I speak on that because she came into the community on Saturday morning, and by Saturday afternoon, the Minister of Local Government also visited the constituency. He distributed care packages, 60 to the sitting Jamaica Labour Party councillor, but I was not informed of his visit prior. The 3 other councillors who happened to be PNP councillors were also not informed of the Minister of Local Government's visit.
But then go on, man, till riot broke out of
They got no
Jamaica.
packages from the minister. Only the JLP council received packages. And finally, the Minister of Justice came on Friday, and my constituency office happened to be right next door to the venue that he visited. I was not notified in advance. No, it doesn't matter. I see the statement from the minister, and labeling a statement as being contained or filled with lies or accusing me of lying does not make it untrue, and it does not change the facts. The facts remain, as I stated in my earlier video, that the minister came into the constituency without prior notice. The minister came into the constituency, handed out or distributed supplies. It doesn't matter if it was 7 or 77. The parliamentary practice, the convention still remains. It is improper.
It is improper.
Visit an MP's constituency.
It is. I'm not come out from the platform. I don't want to liberate over this, man. If I don't come to preach peace and unity, everybody will get affected. Forget something, I don't want to come here and time because I'm black.
Towards good governance.
I love what I deal with right now. And the people that will get affected need help. And that we are talking about. You know, come here with no nonsense on this platform. Yeah?
Oh. And not just give just passing notice on the day, but proper notice. Perhaps it is time for us to implement that here in Jamaica. Secondly, I speak on the issue of housing because the speaker made mention that persons that she spoke within the communities, the JLP communities that she visited, were not hopeful that they would get assistance. Like many of these members of parliament, I also received only $10 million as an allocation for housing repair. On the very first day that my constituency office reopened after the hurricane, we had over 600 persons in attendance at the office asking for housing assistance. Over 600. And when I went into communities like Mosquito Bottom in Windsor, they didn't even know that there was a deadline given by the government to report on matters such as those. So their information was never captured.
I raise it to say to you that the government, you've heard, has given a directive that they are recommending that you give 100,000 to each beneficiary. I have not been able to do so. I have taken the decision that I cannot choose who should benefit and who should not. I cannot choose who should get help to put on back their roofs and who should not, when everybody needs help to put on back their roofs. And so every one of those 600 and odd persons who applied for housing assistance, I've submitted their names. And so it means that they're not going to get 100,000 each. It means that some of them going to get $12,000, which is only probably 3 sheets of zinc. But what do we do when the funding is not sufficient? And let me make it clear. I have PNP people who voted for me. I have JLP people who voted for me. I may have people who never support the politics before and them go vote. So I don't care who people vote for. When I go into a community to distribute supplies or to assist people, I have never asked them who they voted for. Once I have it, I'm going to share it, even though it means sometimes getting quarrels from your own supporters who feel as though you're helping the other side more than how you're helping them. And I say this to say that we do not support the practice of division. We do not support the practice of undermining duly elected representatives whose only intent is to provide help for people who are suffering. We see people who are in need. We don't see JLP and we don't see PNP. We see people who are vulnerable and who are depending on the government to make the right decisions so that their lives can be better. And that's the only objective that we have over here on the People's National Party side. Now, finally, I speak to the issue of infrastructure. The constituency that I represent suffered not just physical loss to the houses or road work was completely destroyed in areas, particularly in Santa Cruz, where it seems as if a bomb was dropped overnight. We have holes in the roadways which were over 20 feet deep. Now, I've tried my best to assist, but these are all temporary gaps, temporary stop gaps, by using the debris that had been washed away to try and fill back the holes so that people can't say that they are marooned. But what is the plan going forward? Because one more show of rain and the whole of that wash away and people again going to be marooned. The people in Abraham, who even though we tried to fix the road and did the best that we could, they tell me that when rain falls, they still have to walk to get home up in the hills because the cars still can't manage because it's mud and dirt that was used. So it has slipped away and is slipping away. What is the plan? Are we going to wait until something disastrous happens before we put in place plans and solutions that will actually inure to the benefit of people? In Santa Cruz, we have a situation where all of the mud, all of the debris from the hills washed down into the town of Santa Cruz. So it is not uncommon for you to see people wearing dust masks when you visit Santa Cruz. What is the plan? The government has started to clear the roadway in Santa Cruz without any notification to me as the member of parliament. And now we are left with a situation where I don't know if there is funding that is left, but the road needs a water truck to actually wash away all of that mud, all of that debris. What is the plan for Santa Cruz? What is the plan for the areas in Thornton? Thornton has over 1,500, almost 2,000 persons, and 95% of Thornton lost roofs. Some houses have completely crumbled. What is the plan? Because my $10 million done, and I still don't know how we're going to help the rest of the residents in Windsor and the other areas, even in Brace River, that got flooded out. And go around and pick up 2 sheets of zinc and nail it on or tack it back on. But them know so the next shower of rain, them are going to wet up again and another strong gust of wind, it's going to blow off again. What is the plan? I close by saying that I have absolutely no intention to be cantankerous, and if I appear to be somewhat passionate, forgive me. But when you represent people who see you as their only hope, who come to you because they have nobody else to turn to, we have a duty to speak on their behalf, and we have a duty to hope that the government listens and the government acts. Thank you.
Thank you, Member of Parliament. It will appear as if we're on the cusp of a health crisis. And what we have recognized is that there is a suboptimal response from the government in this regard. We're going to have our opposition spokesperson for health and wellness, MP Alfred Dawes, to address the matter.
Thank you, Senator. Leader of the opposition, my colleague, members of parliament, journalists here, those who are tuning in, good morning. I also wish to greet those who are tuning in merely with the disgraceful intention of trying to distort what we say and
Yeah, man, I said some of them.
to present a false narrative
Most of them
to
time,
their own
the
agenda.
crosses them.
I greet those who have spent their lives playing politics to stop playing politics with people's lives. Today, I give you an update, having met with the technical team at the Ministry of Health, the Minister himself, and being on the ground, conducting missions, meeting with persons who are actively involved in trying to improve and assess the health situation.
Of course it is, Jai. And the government responsible for every Jamaican.
Parishes.
I bet they go on with their
We
foolishness,
must
man.
give what is due to Caesar. The Ministry of Health has, in fact, done quite a bit, as Dr. Campbell said earlier, in terms of being responsive to deploying some of the clinics and the restoration of services at some clinics and the improvement of the infrastructure of some hospitals, such as Cornwall Regional Hospital, having now had a roof replaced by Médecins Sans Frontières, or Doctors Without Borders. We, however, are very concerned about whether or not public health care is getting the attention it deserves. We have to understand that the crisis that is unfolding now out west, it is not merely the realm of the Ministry of Health and the technocrats, doctors, nurses, and vector control workers, public health inspectors. It is not under their control. What is happening is that it is a multidisciplinary, multifaceted approach
The top
that
of the
is
screen,
needed to
man.
stave off the impending crisis. We are already in the midst of a leptospirosis outbreak, and we could have seen this coming. We ought to focus not only on trying to send out information to say avoid streams and water, avoid rodents, but we ought to look at how we can address the environmental factors that are causing this outbreak. Garbage collection is an issue. It is piling up not just out west, but across the island.
Right across
Even
the
in my
island.
constituency, that was
All over there for
from the
sure.
front of the hurricane.
Country,
Water
the country is
an
a
issue.
mess.
We heard from the MPs that water is rising in some areas. There is a stench of dead animals, and you cannot simply say to people avoid contaminated water when that is the only water that they have available. So we have to look at the cleanup, we have to look at the access, and it is this multimodal approach that we're going to have in tandem with the work of the Ministry of Health that is going to stave off a worsening of the leptospirosis outbreak, as well as try to mitigate, if not completely avoid, the threat of dengue and chickpea. When we speak about leptospirosis being an issue, it is a disease that is largely mild, but when it gets bad, and it can lead to death because of liver failure, bleeding out, renal failure, and therefore early diagnosis and treatment is essential. Questioning the capacity of the Ministry of Health to adequately confirm cases of leptospirosis. Do we have the capacity locally to test for leptospirosis kits into affected areas where we can test for the antibodies that are elevated when you have an acute infection. Early testing helped in COVID, and anyone with a passing knowledge of medicine understands that the earlier you intervene in a disease, the better the outcome, as well as the less likelihood you will have long-term complications. So we need to be testing. To say that we have 11 cases of leptospirosis begs questions. Are we testing enough? Are we missing cases? And if we are faced with a national outbreak, can we ramp up testing to have results back to see whether or not the case that we're dealing with in front of us as a physician is really leptospirosis or not? So we need that information from the Ministry of Health. And what are they saying about the use of rapid kits that can be made available at clinics and even with partnerships with private doctors, as well as distribution through volunteers who are going into the communities conducting medical missions. There are still critical shortages of basic medical supplies, manpower, and of course, functioning equipment, some of which would have been damaged during the passage of the hurricane. We know that there are patients who have lost medication because they do not have a fridge that is working, because they do not have a generator. And therefore, you have to be concerned about non-compliance as a result of these socioeconomic factors that are now more than ever playing a role in healthcare. We have gotten some complaints about the process to facilitate missions. There seems to be a lack of coordination on the ground, even if persons are fully registered and they have been listed as partners. They still face some obstacles, whether or not the team on the ground were expecting them, and who are they partnering with to mobilize the people in the community. In many instances, if the members of parliament are not a part of the mission initially, they do not have the wherewithal to rapidly get out persons and mobilize them to take advantage of the free medical services. So again, this is an echo for partnership and not just trying to have hegemony over the relief efforts. And this includes the medical missions. Now, when we speak about the way forward, because this is not going, the situation that exists on the ground is not going away anytime soon. There are too many people who are homeless. There are too many people who are marginally living on the fringes of survival. And as a result of that, the conditions that exist for leptospirosis to continue and for dengue and chikungunya to have outbreaks here. We're only 90 miles away from Cuba, and they have more people with leptospirosis, with dengue and chikungunya than there are people living in Jamaica, over 3 million. The conditions exist and they will continue to exist for a while. So we have to plan accordingly. We cannot wait until we see a spike in cases and then we have a knee-jerk reaction. We must be able to anticipate that there will be an outbreak, there will be a spike, certain communities will be affected more likely than others, and we try to stave it off and put in mitigating measures. I don't believe relying on PAHO. Cuba is dealing with their own epidemics right now. They have best practices that, because of the relationship that we have had with Cuba for quite some time, they're willing to share with us. Let us call on the Cubans for help. They have a very good system where they look at the environmental factors. Is there a lot of garbage? Is there a lot of stagnant water?
Well, Jamaica brought up here garbage over here
in the area, all of which we know has been described as happening out west. You look at these environmental factors, you look at the behavior of the people. Are they bathing in the rivers? Are they using exposed to contaminated water? You look at their access. Do they have access to healthcare, access to public education, to resources? If they get sick, they can report in or go to a hospital. And of course, you have to look at the history of the area. There are some places in Westmoreland that have a history of typhoid. Now, when you factor in all of these determinants that contribute towards an outbreak, you go in, you engage community leaders, you launch public education campaigns, you clean up the place, sanitize, ensure that you have adequate garbage collection, ensure that you have potable water, you treat breeding sites, you do fogging, get rid of the vectors, and then you may reach a point where you do not have a spike in cases. And that is real primary prevention. That is the basis of public health, which has been proven to work over 100 years now. So maybe 200 years from the cholera epidemic in England. So we want to entreat those who are in charge of the disaster recovery to employ early warning systems for healthcare now. Not just surveillance to say that you have spikes, but predicting the likely locations of outbreaks and intervening. And to do that, you must combine environmental data, behavioral patterns, historical outbreaks, and you must also ramp up testing capabilities, confirmation testing, as well as introducing rapid testing. And with that, we can have early intervention, a simple penicillin that can save lives in the case of leptospirosis, or the treatment of renal failure with fluids early out. Dengue, you identify when it has become the hemorrhagic fever where you're bleeding out and have early intervention as well. And we must have a mechanism where you have real-time reporting of fever. If you have a fever, there must be a way for you to report that you have it so that you can get tested. Vector control has to be augmented by private contractors, bringing in back the part-time workers, but the schedule for vector control cannot be such that communities, such as mine in Southeast St. Catherine, basically have fogging once every 2 weeks at best, and we have 18 communities, and we are plagued with mosquitoes in Portmore. So we have to ramp up vector control immediately, and because
we not said that long time now. What kind of government knows that that can be the first
infestation? We have to ensure that garbage is being collected across the island in a timely manner. For communities where you cannot effectively solve the issue, especially if there's rising groundwater, evacuate the residents. Get them out of the conditions that are going to lead to respiratory illnesses, waterborne diseases, as well as those that are vector-borne. And of course, you have to, and this is echoing the call of all my colleagues, do not try to do it alone. Engage both sides of the political divide. Engage community-based organizations, the church, community leaders, get everybody on board to identify the most vulnerable, to pinpoint the areas where you have to have a heightened presence. And this is the only way we can have an effective response. We may have to consider looking at the distribution of mosquito nets and repellents to avoid persons who are living outdoors and in shelters getting bitten by mosquitoes. And of course, the Ministry of Health has to anticipate that if all of these measures fail, we're going to have a surge in patients coming into the hospitals. What is the surge plan in terms of bed capacity, in terms of staffing, testing, and treatment? We'd have to have
people in a serious problem, a serious thing we talk about
for the worst case scenario. And then of course, rehabilitation, especially when it comes to CHIKV, is important for long-term productivity and pain control. And in all of this, I left this for last: mental health. People are numb now. They are not feeling and processing what is happening. You cannot have a psychologist or a mental health team going out and tell them better must come and then send them back to their tarpaulins to live. We must have coupled with mental health checks and interventions hope for the people that their conditions will be improved in very short order, and we're not forgetting about them when the news teams have left and they are on their own, and we're looking at this situation as a 9-day wonder. We must have interventions coupled with the psychological effects, psychiatrists getting involved. All of this must be complemented by improvement, tangible improvement in their lives, so you give the people hope. This is where I leave it. This is what is happening on the ground. This is what we must prepare for. And if we don't prepare for it, we can have the expectations that we will pay for it in lives. Thank you.
Whoa.
MP Dawes, we're going to invite the leader of the opposition to close out the presentations in this morning's press conference.
Still morning. Good morning, everyone, members of the media, listeners, my colleagues who are here. We wanted to have this press conference this morning. It's the second press conference we've had since the hurricane hit Jamaica. First one was about a week after the hurricane hit. We're now about 4 weeks.
For the weekly press briefing.
3 weeks since the press conference. And I wanted to have the elected representatives of the people in the constituencies that have been extremely badly affected to have the chance. I wanted to give them a chance to describe to the media and the public what they're experiencing and the deficiencies in the response, the gaps that need to be filled, and the decisions that need to be taken. This is not to be anything other than responsible representatives of the people to bring to the attention of the authorities and the public what needs to be done to make the overall response more effective. We know that there are hundreds of thousands of people whose lives have been turned upside down by this cataclysmic event, and the effects of that event are ongoing. We talk about phases and initial response morphing into recovery and other phases. But the truth is that because of the very ad hoc arrangements that have been put in place thus far, the level of normalcy and stability that have returned to the lives of people in the badly affected areas is very erratic. Some people have received relief because of good fortune, happen to be living in close to the major arterial roads, or they have had the benefit of interventions from international and local NGOs, disaster relief organizations, but many, many others have had little or no interventions. And so the situation is not an even one. And there are far too many people still who are suffering from the initial effects of this hurricane. The opposition, as I said at the first press conference, and I want to repeat it now, we must not seek to score political points as a competitor of the government. This is not the time for that. We've just gone through a general election barely 2 months ago. This is a time when Jamaica's facing a huge disaster, an economic disaster, a social disaster, a humanitarian disaster. And the role of the opposition at a time like this is to help the government to respond as effectively as possible, because we want Jamaica to get back on its feet. We represent people who need that to happen. So when you see us perhaps disagreeing with the government on a particular issue, it is not as a result of being cantankerous or being trivial or petty. we take issue with those things that we think are fundamental and that we should not allow to be implemented in the originally proposed way, because it will have a deleterious effect. It will have an effect on the governance of the country or on the response to the disaster, which is suboptimal and needs to be improved. And that is how we have been attempting to approach this. Equity, transparency, and accountability are vital in the response to a disaster. We have heard numerous reports that political representatives of the governing party are being used to distribute government relief, taxpayer funded or donor funded through the government relief in ways which they have no legal or political standing constitutionally to play that role.
Take them
Elected
to court.
representatives must be included in things that are happening in their constituency so that they have information, so that their information can be shared with those who are operating on the ground, and you can work together with all stakeholders, including those who are representing the other side of the political fence, to get us the best possible solution in a difficult situation. That is not happening. I have been bringing these incidents, as I hear of them, I have been bringing them to the attention of the Prime Minister through WhatsApp. He has not responded to me at all since last week, the Saturday before last, 10 days ago. I have not heard from him in response to any of my messages. So when the Minister of Information says that we have been communicating constantly, that is simply untrue. There has been a total cessation of any communication, certainly coming in my direction, from the Prime Minister. I note that there's a decision that has been taken to enact legislation to establish a new reconstruction agency, the acronym NARA, National Reconstruction and Resilience Authority, I believe, which will have wide powers to ensure that decisions can be taken very quickly when it comes to rebuilding, for example. I know that this is something that the private sector have been agitating for, and I see the need for it. But where you are circumventing normal procedures because the circumstances that we're in require that, it is all the more important that the thing be done in a transparent manner and that all critical stakeholders should be at the table when those decisions are being taken or being reviewed. The Prime Minister, in making that announcement, spoke of a broad-based governance structure for this new authority. I had called for something of that nature right after the hurricane. I wrote to him about it. However, I noticed that he, at his press conference when he announced it, he made no mention of the opposition being at the table. I don't know whether that omission was inadvertent or deliberate.
Man, no one work with them, man. It's clear.
If we want Jamaica to get back on her feet as quickly as possible, if we want to avoid social dislocation, and if we want people to feel that the response is equitable, is well designed, and is without political bias, it is important that critical stakeholders be at the table. And the opposition, with 28 seats in the parliament and almost the same number of votes in the last election as the government, should be part of that process. We are willing to serve, but we are currently being excluded. All of the committees that have been established under the cabinet, including the private sector committees and so on, the opposition is not present on any of those committees. The one concern I have as well is in the way in which the post-Melissa response effort is being administered. Jamaica has
criminal around Jamaica,
a
we not get no
legal
better.
framework for responding
A criminal, all of them.
to disasters. The National Emergency Response legislation called the Disaster Risk Management Act, which we passed in 2015 and which the government used extensively during the pandemic. Despite the Constitution having provisions for states of national disaster to be declared, and there's a constitutional framework for addressing it, the government preferred to use the disaster risk legislation to respond to the pandemic. What we have seen in relation to this disaster is that it is effectively being marginalized, partly because ODPEM, which is a critical institution within that legislative framework, has been denuded of authority, status, and capacity over the last decade. And this is unfortunate because the legal framework which exists in Jamaica is well designed in accordance with international standards, and it contemplates responses being at the national level, at the parish level, through the municipal corporations, which used to be called parish councils, and at the community level. They're all supposed to be integrated so information can feed its way from the ground up seamlessly to the National Emergency Committee, NEOC, the National Emergency Operations Center, and decisions can be made on the basis of complete information or the best possible information, and then directed and resourced through that structure so that the ground gets the benefit of being comprehensively included in whatever the relief is. What we have seen is that structure is not functioning. The parish councils have not been engaged and resourced so that they can play their part, despite them having disaster professionals and other professionals available to them to play the role they're supposed to play. And instead, we're seeing parallel structures
because the PNP have too much
being put in place, which are some essentially running alongside the legal structure that exists, and in many cases superseded them, but without proper coordination. Those parallel structures are those set up by cabinet, and also those involving our international partners, NGOs and others, without whom we'd have been in an even worse situation than we are now. We're very grateful to all of the agencies that have been here putting a lot of effort, but the coordination needs to be sorted out, and the legal structure that exists to ensure that relief is distributed fairly, equitably, and comprehensively based on the best possible information on the ground, that needs to be activated properly and not circumvented. I close by reiterating that we have value to bring to the table in the response to this disaster. We have representatives at the local government level. We actually have more representatives at the local government level marginally than the government do. We have a substantial number of representatives at the parliamentary level. They are all on the ground getting information daily from residents as to what is happening. The political organizations of both parties go into every nook and cranny of the country, and therefore the organizations are well placed to get information to feed into the disaster response system. That is not being leveraged. That is an asset that the country has, and which the disaster legal framework contemplates being engaged, but is not being engaged and is being marginalized. And that is why we're having suboptimal results, where people are still a month after the disaster feeling abandoned by the government because they haven't seen anything happening to take them out of their plight. The housing situation, we've heard the announcement about the 5,000 container homes that will be brought in and distributed through the NHT. That is not likely to come into effect, based on what the Prime Minister himself said, until the second month of next year. In the interim, what is the solution for the people who have no shelter? The thousands of Jamaicans who are coming into the Christmas period, every time it rains, them wet up. Their children, old people, pregnant mothers, persons with disabilities.
Wow.
What is going to happen to them? I said at the last press conference, in response to a question from the media, off the cuff, I was asked what did I think would be an appropriate figure to empower we'd had said 50 million. Certainly, a $50 million allocation would allow MPs to respond to the huge need in a more meaningful way. Instead, they've been put in this invidious situation where essentially they're asked to allocate 100 people when the needs of their constituents are thousands of people. And that simply is just a recipe for
disaster.
A lot of frustration and bitterness. The government needs to wheel and come again with this and rapidly put in place a response on the ground to the shelter needs. It is an opportunity also to run some income on the ground where people have lost their jobs or their businesses have been closed and get the economy moving. We could have mobilized brigades of people who need income to help with the cleanup, which is now very sporadic and needs to be dealt with the public health risks that Dr. Dawson has spoken to again, and also with the shelter issues. Let us mobilize people on the ground, have some
Why
money
Jamaica
flowing
and
through
miss
those
a grand
communities,
opportunity,
get the
man.
economy
And get
back
change on the
at
name
the
taking.
grassroots level,
And if it's
so
suffer
that
too.
people can have some hope, and so that the needs of the people are being
So
addressed
it might not care
efficient
about
and
care
quick
about
way.
no.
We
And
will play
money
our
once
part
he
if
run
we are
down gonna
allowed
put
to
in
do
problem
so,
to
but we
G20
bemoan
about money.
the misinformation being fed about the role we're playing. We are feeling very excluded from all decision making, and the way in which the system of relief is operating on the ground is not in accordance with established norms, and is also resulting in suboptimal distribution of relief because the relief is not being done on the basis of proper information as to the needs. So that is why we will be having regular press conferences going forward, because we're now at a time when the country needs to change gear in a forward direction, and we feel that the government needs to be guided by persons who are in the feeling it on the ground, the neglect and so on. And it's our role, I think, to do that. The Parliament doesn't lend itself, as currently managed, to having that kind of open dialogue, that opportunity to share what we have to say. So we will have to do it in this manner and other manners. So I thank the media for having given us this time, and we look forward to partnering with you as we play our part in getting Jamaica back on her feet. God bless Jamaica, land we love. One Jamaica. Unity is a must. Let us pull together and rebuild our country. Thank you.
Thank you, Leader, and thank you again to all our speakers who presented. We'll provide the opportunity for members of the media to raise questions. So please identify yourself and the individual to whom you are putting the question. So, yeah, journalists from Nationwide.
Now with them I come with them now.
Good morning, everyone. Mahiri Stewart, Nationwide News. Mahiri Stewart, Nationwide News here. My first question to the opposition.
Wait and listen.
Question to the opposition leader in terms of the allocations that are being given to the members of parliament in order for them to rebuild. We're hearing in terms of the housing that 10 million isn't enough based on how many people in the constituency are affected. I know that there was a suggestion earlier in terms of a fixed figure. You said it was off the cuff as 50 million. But in terms of, given the different characteristics of the constituencies and the different amount of persons affected, do you think a fixed figure would be more relevant, or would it be based on the constituency?
I don't think in this situation it's sensible or realistic to have a one-size-fits-all basis for allocation. All constituencies have some needs, because the hurricane did have impact on everywhere, but the degree is on a huge differential curve. And clearly, those constituencies, which we know from the mapping that's been done and the data that we have, where the extensive damage is, should get realistic allocations in keeping with the extent of the damage and loss that they have suffered. And every MP, I think, would accept that that's fair and reasonable. And so when I throw out a number, I'm not suggesting that every constituency must get the same thing. But I do think that those that are suffering the most, and every MP who has spoken here is in a constituency where there is extensive loss and damage and dislocation. They need to be adequately resourced and included in the process so that the people can feel that the state is responding in a serious way, in an efficient way, and in a fair and equitable way to the disaster that has befallen their lives.
Okay,
So in light of that, would you think it would be fair if the MPs would do their assessment and determine a figure based off of the damage that they've seen on the ground?
I think that we don't need to go through a scientific survey of the damage in advance of providing relief. It is well known the extent of damage that there is. It's easy to have a preliminary figure, which you know is not going to be the end number that's needed, but is a decent start, and get going with that. A month has passed. Children need to get back in school, but people are still living in shelters in schools that are badly damaged. Teachers and the Ministry of Education want those people to leave. Nothing is put in place for them to go to. And now the MPs are being told, we must deal with it, but no resources are being provided. So it's a crazy situation. And it requires a proper, well thought out response with everybody at the table who has value to bring to that decision. And that's what's lacking now.
My next question would be to Ms. Perkis. I did do a story a few weeks back on the issue of the rising water in Chigwell, Forest, and Leafy. I think those are the three communities you had mentioned. In terms of since then, what can you say about the level of water that's in those communities, and how are the constituents that live there, how are they doing right now?
All right, firstly, let me clarify that Leafy was not one of those areas marooned by water. Chigwell, the water continues to rise. Water is receding in Forest, but it's going over to Chigwell, so it continues to rise in the Chigwell area.
Okay. And I guess this would be a question for all the MPs in general, but in terms of resources, specifically water, Dr. Dawes had spoken about the fact that contaminated water is an issue and people need potable, clean water in order to respond to the disaster. What can you say is the status of the restoration of water in your constituency? This is for all the MPs.
Well, our main booster systems have been damaged, mainly Great River. That has been repaired so far, but we do have booster systems in different areas that are still damaged, and I will use this opportunity to ask NWC to go in and pay some attention to those areas. We have a number of rivers in eastern Hanover. Persons are drinking water from the springs. I don't believe it is safe. I have warned against it, but when we have officials going into the communities that are vulnerable, the experts, and asking them same, I believe it is more effective than just a member of parliament saying, don't consume the river water, don't consume the spring water.
I just want to add to what Member Perkis said a while ago in terms of water. Yes. In the majority of these constituencies that are affected by Hurricane Melissa, the system is served by the Jamaica Public Service Company, JPS. And the majority of those systems are still out as we speak. The government speak to deploying generators across the country in these areas. There's still a lot of areas that are without these generators as we speak. So in terms of the water infrastructure, because out of the 227 systems we have across the country, they're all independent. There's no linkages. So therefore, the majority of these stations act independently, operate independently. So there's no synergy between. As we speak now, I know that the JPS is trying to repair a lot of these stations along with hospitals and fire stations and other entities. But as far as water goes, because of the electricity from the JPS, a lot of these areas are still, a lot of these plants across the country, across the different constituencies are still out. as we speak. So individuals have to be going to rivers, streams, which the water is unsafe as we speak.
And has water been trucked in terms of the places
Well,
that don't
the
have
government
running water?
provided $2 million to each MP to truck water. But here again, I want to add and say that an average cost for a truckload of water is anywhere between 40,000 and 60,000. So if you look at it, that can only do basically in a constituency. You can basically truck anywhere between 30 and 40 loads of water, and that's what you're supposed to be trucking daily. So the $2 million roughly is a drop in the bucket as we speak.
Okay.
We'll also just add that in some of the badly hit areas, the containers that people use to store water have been badly damaged. Black tanks have been destroyed and so on. So even when you are trucking water, it's a problem as to what you do with it, and that needs to be considered in responding to the water crisis.
I just want to add that the Logwood treatment plant suffered damage shortly after Melissa. Power has been restored. The generator there was damaged. I want to urge the government to ensure that this process to procure the generator starts immediately, despite JPS has restored power to the plant. This plant feeds majority of Hanover and parts of Westmoreland, and so it is important that there is a generator there. I know there was generator was rented during the time until power was restored only recently. But as you know, there are times when the JPS will go down, and as such, it is important that we start the process of procuring a generator for that plant.
Thank you. Do we have any other question online? All right, thank you so much. I want to especially
online.
Have a question online?
Online. Yes, I'm online. This is Colin Bell, Portland Spice TV. I have about 3 questions.
Okay.
Dr. Dawes, you spoke about all these possible breakout and the possibility of we paying for them in lives if we don't do the things that we are supposed to do. Could you elaborate a little bit more on some of the things that we can do to prevent any more breakout, especially cholera? Also, we want to find out from Dr. Campbell. We saw you put in a water station somewhere in your constituency. The question is, how many of these water stations have been placed in the communities that water is unsafe to use? And is there a plan to make sure that some of these water stations are placed in other communities?
All right.
I'll leave it there. Thanks.
So let's look at what we're faced with on the ground right now. Leptospirosis. This commonly is simply attributed to rats, but it can affect dogs, cattle, cows and goats. And what happens in many instances is that the rats get into the houses. Now, when you have a sugar belt like Westmoreland, where you'll have cane piece rats, and everywhere in Jamaica where you have garbage piled up, you will have rats around. They get infected. Humans are no longer in houses that are protected from the elements. They're mingling with these vectors. You're going to get any disease, and because leptospirosis is what is brought into the households by the rats and the cattle that are infected, dogs, that is what you're going to get here. In other countries, it will be bubonic plague. We're not going to say that in Jamaica, hopefully not. You spoke of, so it's really a matter of trying to, as I'd mentioned, a multifactorial approach where you get proper garbage disposal, clean up the areas, and importantly, get the people out of the areas where they are exposed directly to animals that are carrying these diseases. And it may mean that you give them proper housing, and if not, you evacuate them. The other illnesses are waterborne illnesses. You mentioned cholera, but far more frequent in our population is just simply dysentery, diarrhea. You can have really bad diarrhea from contaminated water, and water is contaminated. The storm water has gone into the underground aquifers. People are drinking from rivers and streams, so they're going to get gastroenteritis. Now, what was very maliciously twisted when I spoke about cholera the last time is that it can be imported. And as long as you have people living in the conditions where they're exposed to contaminated water, consuming contaminated water, any disease that is not endemic or native to Jamaica can make it here because we have people coming in and out. The question they ask, we have how many million tourists per year? The millions of tourists coming in per year are not going to interact with people living under tarpaulins and drinking contaminated water. So we have to be mindful that our minds are not trapped into thinking a particular way by those whose sole objective is to play political football. So we have to be mindful of all of the conditions that come here. Malaria is another one. As I mentioned, in Cuba, you have chickpea and zikvi as well as dengue. And there's another one that they have. To be honest, I don't even know the name of that one. I need to do some reading on it. But it's another arbovirus similar to chickpea and dengue, transmitted by the same mosquito that we have here in Jamaica, the Aedes aegypti mosquito. So we have a lot of things to look out for. And it is really the basic principles of public health: primary prevention, early detection through testing, mass testing, and treatment in the early stages when you have a better outcome, that we have to really focus on right now. And that is what is going to leave us saving lives.
Dr. Dawes, before you go, do you think it would assist if the government, you used the word a while ago, but evacuate people who are our most vulnerable, the elderly, young babies, mothers with young babies who are living in these conditions? Would an evacuation like that also assist in preventing more outbreaks?
Yes, and yes. Unfortunately, we are doing reverse evacuation, where we're pushing people out of shelters to go back to the conditions that I spoke about. And in no century has anyone faced with an outbreak put people into harm's way if they say that they are a civilized society. We have to do better. We have to do better.
Quickly. Yes, we have, through a private company, we're able to get some water tanks, and we set up a system in White House, one in Darliston, and we've currently procured some more tanks through the ministry, speaking to Minister Samuda. So we can set up a system at Cottage, one at the Sorrel Factory in Betheltown, and one in an area called Audier in the White House division. The connections to the tanks were set up by UNICEF, and they take the water from these rivers or streams. They treat the water to make it potable. They have also set up a system at Belmont, one in Gordon, and one at the car park in Darliston. So the aim is trying to see how we can divide up the constituency and put them in critical areas, so at least people have access to potable water.
It's something that you would recommend to the government. And just one final question for me. The opposition leader early in the piece spoke of a task force, a broad-based task force to oversee the operation, the recovery. Would the opposition look at your members of parliament putting together that committee in their constituency, and to say to even donors and private sectors outside, when you're coming into this area, here is a structure? Thank you.
Yeah, the structures exist. The MPs are there, the councillors are there, the parish council, municipal corporation is there to support the councillors' work. There's a disaster representative on each municipal corporation, and there are also engineers and other assets that are available. It's supposed to be mobilized and supported so that they can be the ones that are the conduits that then work with the community leaders in the communities and ensure you have broad coverage, you have complete information, or as close to it as possible, and the disaster response can be efficient and effective and equitable, transparent and accountable. That's what we're really saying should be done. We've departed from that system. We have no other system in place. And we're relying entirely on the goodwill of our international partners. And that's helped us through the last 4 weeks. But this is going to be a long haul. Jamaica has to get its act together and organize this thing properly.
Yeah, just two more questions to Dr. Campbell. One being, could you expound on the Adopt a Family initiative and how it works in case people watching want to assist? And secondly, outside of funding, how else do you think RADA can help the western end of the island that have experienced damage to farms?
I'm not sure I heard the second question.
The second question would be, in terms of the damage to the farming of the western end of the island, most of the MPs said the farms are destroyed. Outside of just funding, how else do you think RADA can assist these farmers in getting their feet back on?
Sure. So the Adopt a Family initiative is geared towards streamlining the help that is coming to the constituency. So as I said, a part of the problem is currently how relief is coming in, that it's very haphazard. And what we're seeking to do is to pair donors with families. So we've had 6 persons that have contributed a container home, and we have another 6 that is coming. So what we are doing is prioritizing single mothers with 2 or more children, and then we pair them with a donor to get the unit and retrofit it with bathroom, meaning shower, toilet, face basin, mirror, door, and to transport it to the constituency is about 4,000 US. And that's not the only way they can do it. We're also working with the hardware for them to work out a bundle to say this is what would be needed to do a room for 1 bedroom, or this is what would be needed to do a room for a 2 bedroom. Or as we had on Sunday, a group that came in and adopted 5 families, and they're working with them over the next 3 months to ensure that they have groceries and the necessary household items that they would need. So it's really just trying to streamline the benefits by putting the donors directly in touch with the beneficiaries. In terms of agriculture, you know that agriculture is the main employer of labor. And between St. Elizabeth, which is considered a food basket, especially southern St. Elizabeth, there has been significant damage. In Westmoreland, we have a lot of government land. And so a part of what we can do is to look at those government land and see how we can make
internet
available to farmers, and how we can help them with the land preparation, or we can help them with the planting materials and those items to get back going. We also need to see how we use newer technologies. We can use hydroponics to grow most of the vegetables and those items within a shorter period of time. So the government just has to be creative. As I said, we should have used some of the debris, some of the lumber to make some of the poultry houses, to at least ensure that some persons in the communities, at least they have access to the main protein of Jamaican people, which is chicken. Thank you very much. Have a good day. God bless you all.
Thank you, everyone, and thank you for joining us. And as the leader said, you will hear more from us. Thank you. Have a good day.
All right. Bye, everybody. Thank you. Thank you. Thank you. Thank you. Bye, everybody who stay on. That's true, Nardi, yeah, Roper. All right, later, we're going to join back if them keep Parliament. We don't know if no Parliament I keep, but we're going to look out for say if Parliament I keep. Then we're going to come back and do Parliament. All right? Have yourself a great day. Thanks for the support. Bye.